Hello everyone, myself Subrat Kumar Naik. I'm a second year MBBS student at GMCS Sundargarh. So I'm going to create a complete playlist जिसमें कि जो सेकेंड ईयर के सारे हिस्टोपैथोलॉजी के स्लाइड्स होते हैं मैं उनको हर एक स्लाइड्स को डिटेल्स में यहाँ पे एक्सप्लेन करूँगा. सो हमारा आज का जो वीडियो है इसमें मैं मेलानोमा को कंप्लीट डिटेल्स में एक्सप्लेन करूँगा. So let's start the video. Melanoma is a malignant tumor of melanocytes. So first we see what are melanocytes that are present in basal layer of epidermis, eye and mucosa. So let's see in this figure. There are two layers of the skin, epidermis and dermis. In the epidermis, there are many sublayers like stratum corneum, stratum lucidium, stratum granulosum, stratum spinosum, and stratum basale. So here we have to focus on stratum basale. So in the stratum basale, this is the stratum basale layer. In the stratum basale, we see two type of cells. One is melanocyte and another is keratinocytes. These cells are the keratinocytes, and these are the which have many branches. These are the melanocytes. So these are the two type of cells. Now let's go to the gross of the melanoma. Here you can see this is a melanoma on the skin and the gross. It is black brown pigments, raised lesions, irregular border, ulceration, and bleedings. So let's see the risk factors for the melanoma. Sun exposure, UV radiation, fair skin. The fair skin people are more prone to melanoma, and people with skin family history are also more prone to melanoma and moles. So first see the clinical features of the melanoma. So in the clinical feature, A, B, C, D, E are the five important clinical features. A for asymmetry. So the melanoma is asymmetrical. It's not like a circle or a square or a rectangular or a triangular. It's asymmetrical, means its length, breadth. There is no symmetry in the length or breadth. And the second is B for border. It has irregular borders, means the borders are not regular, it's irregular. C for color. It has more than two colors, like it may be reddish or brown or black. And D for diameter. It has greater than 6 mm of diameter, like you can see this is the diameter and it's greater than 6 mm. Now the evolution, like let's see, this is the initial melanoma, then its size increases, it goes to this, then again its size increases, goes to this, and then at the end this goes to this. This is the evolution of the melanoma. So these are the five major clinical features of the melanoma. So let's go to the histopathology of melanoma. The first feature is junctional activity, like the melanoma cells present at the junction of epidermis and dermis. So here you can see this is the junction of epidermis and dermis. So at the junction there is the presence of melanocytes. These are the melanocytes, and from the junction the growth of the tumor starts or it inverts inward. So this is the junctional activity. Second is the melanin pigments. These are the melanin pigments. Inside the melanocytes or the tumor cells, these brown pigments are known as melanin pigments. And mitotic figures. It's very important. Mitotic figures. These are mitotic figures. So what are mitotic figures? These are the cells that are cut under microscope during mitosis. So as we know, melanoma is a malignant tumor. So as it is a malignant tumor, its feature is rapidly dividing. So due to rapid division, it undergoes rapid mitosis, and due to this, it is cut under the microscope, which is called as mitotic figure. Now, the next one is the vertical and radial growth. This is the radial growth, and this is the vertical growth. It can grow in both direction, like in the radial direction and in the vertical direction. And the next one is invasion. As it is a malignant tumor, so it invades. It invades deep into the tissue. This is invasion. And the most important is Breslow thickness. So what is Breslow thickness? From top to granular cell layer to deepest tumor cells, that thickness is the Breslow thickness. So let's understand. Let's the tumor cell arise from the junction this level, from this junction, the tumor cell arises and it gets embedded into the deep into the tissue. And at the last cell that we found is here. So this thickness is known as the Breslow thickness. From top of the granular cell layer to deepest tumor cell is that thickness is known as Breslow thickness. So let's go to the ISC marker, that is immunohistochemistry markers. S100, HMB45, melan A, that are positive markers of the melanoma. And let's see the what is amelanotic melanoma. The amelanotic melanoma is the absence of melanin pigments in the melanoma. Now let's see the pictures of the melanoma under the microscope. So this is the 40x slide, this is the 10x slide. So in the 40x, let's see, we have to see two important features. One is pigments, the brown pigments. These are the brown pigments. From these pigments, we can identify that this slide is of melanoma. And the second one is macronucleoli. What are macronucleoli? Let's focus in this cell. You can see this is a melanocyte. And in this melanocyte, this is the nucleus and this is the nucleoli. And these brown pigments are melanin pigments. So this dot is the macronucleoli. So we have to focus on two things. One is the melanin pigment, second is the macronucleoli. So in this way, you can identify that this is the slide of the melanoma. So now let's see what is the special stain for melanin. It is Fonta-Mason stain or Mason-Fontanelle stain. So now let's see some important fiber questions. Most dangerous skin cancer, that is melanoma. Most important prognostic factor, that is Breslow thickness. What are ABCDE or the clinical features of melanoma? That are asymmetry, border, color, diameter, evolution. The common marker for melanoma is S100. And what are the different growth phases? One is radial or vertical.